Ministry of Public Health continues to improve access to healthcare services across the country. A regular feature has been specialized medical and surgical outreaches in hinterland villages. On this InfoHub Extended, we take a look at how this initiative has been benefiting the residents in these communities.
Are you ready to embark on a truly epic adventure to an undiscovered corner of South America, where some of the most spectacular natural attractions are unveiled within a beautifully diverse landscape? From the wetlands and savannas to the ancient mountains, magnificent waterways and lush enriching rainforest, which provide a vast playground for some of the most exotic and breathtaking creatures on the planet, including many of the world's giant species. This untouched land of mystery and wonder serves up an exclusive experience for travelers. So are you ready for a new, awe-inspiring adventure? Welcome back to nature. Welcome to Guyana.
At Oriala and Siparuta, residents who have been living in the two villages for a number of years noted that it is costly to travel to Skeldon, Port Morant, or even New Amsterdam for healthcare. Hence, specialized services such as dentistry, gynecology, ophthalmology, pediatrics, dermatology, VIA, among other services were welcomed.
Well, it's really helpful because the outreach that came to Oriala, we don't really have it often. And we have a lot of like sickness, like the extraction of tooth is one, the blood pressure. So sometimes when the hospital is not working, sometimes they have to work, the doctors and the health workers have to go out. So we don't face a great disadvantage at that area.
It is very beneficial because it's due to the poverty. People don't have money to really pay for these things out on the coast. So it is a very valuable services. So it should be done regularly.
So I believe that the government is a fair government, looking all over the country, each and every Amerindian village. This is the last Amerindian village in Guyana, and I believe that we should be get some more thoughts on us. For a very long time, doctor never come in and do such a things that where we eye tests and whatsoever, all people who sick, and so our council is trying for us, but they are not the government.
Residents of Camarang, Monkey Mountain, Waipa, and Karasparu also welcomed these specialized outreaches.
I feel it's good. The health team is here because it would be more easier to do things like this down in our community instead of going straight to Georgetown. Because out there it's much, some of us can't go there and we don't know the place. So when you come here now, it makes it easier for us to.
I appreciate the visit of the doctors in Monkey Mountain because this rarely happens out here. And right now I'm here to do a small surgery in my feet, and I'm thankful for that because I was wanting to know if I have to pay a passage to go to Georgetown and look that after, which is very expensive. And
speaking on behalf of the village of Waipa, Tushao Norbert Adams explained it had been some time since a medical team visited the village. He pointed out that the health outreach comes at a time when the community health worker alone is unable to capture, diagnose, and treat illnesses that may arise in the area.
We was expecting a very good treatment from the doctors, nurses, and whoever it is, because that we haven't seen any doctor or trained nurses or medics or dentists for years ago. And then we need a proper medical care receiving from the team.
These outreaches are in keeping with the ministry's mandate of making medical services accessible throughout the country. The ministry is also seeking to place specialists in the region for longer periods. This would mean that residents would routinely and more readily have access to primary healthcare services as well as specialized services.
the mandate of Ministry of Public Health is to ensure that different levels of health care is being administered to persons in various communities. And persons need to enjoy not only primary health care, meaning to say that health care being done at a health post, but also you can experience secondary health care, and that is health care that you would receive from a regional hospital.
According to Director of Regional and Clinical Services of the Ministry of Public Health, Dr. K. Sheko, this fits into a wider vision of the ministry ensuring health services in Guyana is accessible and adequate to every person regardless of their location, ethnicity, and religion.
As the ministry's policy is to have Guyanese to be among the healthiest in the Caribbean. So with that in mind, we have remote areas. So what we would have planned from the regional health services perspective is to ensure that outreaches are being done within those remote areas. And you would have seen Oriala was considered one. We have other areas that we need to go to in the different regions like 1, 7, and 8. We need to go to places in region 7 like Camarang and Kaikan and the different remote areas in even region 9, Aishalton and its catchment areas, all the areas that are challenging when it comes to accessing the services at a regional hospital. So our plans is to ensure that in most or all of the remote areas, we meet the people there. And that is why we consider outreaches to be pivotal in helping us to achieve that goal.
Such an intervention bringing services to the people can only continue until specialized services have been established in these far-flung communities. This is the vision of the APNU-AFC coalition, having healthcare services within the reach of persons. President David Granger has mandated that no person must travel more than 5 kilometers to receive healthcare.
A team of surgical specialists from the Georgetown Public Hospital, the Ministry of Public Health, and other health facilities in Region 2, 6, and 10 conducted a 2-day surgical outreach at the Mabaruma Regional Hospital. Many persons benefited from different types of surgery, as it was the first to be executed in a long time by the health team.
The Ministry of Public Health is going even further in its efforts to ensure residents in far-flung communities access specialized services. This time, persons in the Barima-Waini region in need of surgery were afforded that opportunity. These surgeries took place at the Mabaruma Regional Hospital, where just about 27 cases were addressed over the 2-day period. Acting Regional Health Officer Dr. Lachwi Lal provides details.
We are indeed very happy to have this surgical outreach. We've had it in the planning, and today finally we can say that we're able to execute. We've extended this service to all our sub-districts. We had our patients come over, everyone prepped. We have all our staff and doctors on board, and of course with the support of the Ministry of Public Health, we're able to realize this outreach to bring the services to our people. We've had a total of 27 cases thus far, and those include cholelithiasis. We will be doing some hernia repairs to patients, and we'll also be offering gynecological services, C-sections, elective C-sections, BTLs done for patients, and biopsies. Apart from that, we're also offering ophthalmology services, VIA, VCT testing, and ultrasound.
Persons were transported from all sub-regions to access the free service in Mabaruma. Their travel and other expenses were covered by the region's health department. Here are a few testimonials from persons who benefited from the exercise. Many said the outreach saved them the expense of having to travel elsewhere to have their surgeries done. Joycelyn Lugo, the daughter of Deborah Lewis, who had to undergo surgery, expressed her elation.
Well, I'm glad because she had about 2 years trying for it, but we never get a chance to do it. No, we had, because we live in Venezuela, so we had the money, but then I get a chance with plenty problem.
At one time, one of the testicle one side is more big, right? And I never take it serious. But it's about, let me say, half of this year now, he begin to come down. He said, well, me got to take a surgery, and he had me on a clinic, and I was very happy about it.
Well, it's a very good thing because we live in far in the interior, and a lot of people take in and get sick. And as we living as Armenian people in the far village, with the surgery, the doctor from there is so kind, and he the patient them go, then get sick, then go in there, and they bring them out from so far. So, but it's something very good because checking on your health before they're ailing all the time there and get more sick, and sometimes some people die without checking medical. At least it's something good.
Okay, this is not the first time because see civil doctor before. They check me and I show them and I tell them everything that things affect me from work and it's pain me. When this thing pain, it's telling your liver you pain you. Terrible pain. This is a joke I telling you. I got it, this is a third time before. And the right side I do it 2 times. One time go back and walk and stage bus back inside. And had to go back and do it in board and see a pressure. My niece paid $3,000. From me had the money. Now this one here try to get it done.
One mother, Lindy Austin, whose son was born with hydrocele, said she was happy that her son is benefiting from her free surgery in the region of his birth. Her 2-year-old son, Mitchell Domingo, though scared, was comforted by his mother. 8 obstetrics and gynecology cases, including 2 successful tubal ligations, 1 cesarean section, and 2 cervical biopsies were done. Some of these services, along with the others, are not new to the region, since they are done regularly in the hospital's main operating theater, which is well equipped to do a surgery at any given time. Dr. Serge Paul Singh, resident doctor in obstetrics and gynecology at the Georgetown Hospital, who was part of the operating team, spoke of the scope of these types of surgeries that had to be done.
So we have a few uterine fibroids, around 2 to 3. We have a cervical cancer. We have some BTL, that's tubal ligation. And we have some other patients. We have a CS that we're evaluating also to perform, and termination pregnancy. So usually after surgery, we review them the next day. Usually they will need 2 days observation in the ward. Once they're okay, once we think that they meet all the post-operative requirements, we usually discharge them. And these patients will be followed up by the doctors here and in the regional, in the other outlying areas.
Minister of Public Health Walter Lawrence paid a visit to the hospital, where some patients were in recovery, while others were patiently awaiting their turn to have their surgery done. The minister was pleased to hear of good reports made by beneficiaries as they praised such an initiative.
As so many of the patients have said to me that they're so grateful that they were given this opportunity, because many of them have their families at their bedside. They're very happy to be doing it in their own environment, let me say that. But this is something that we will be doing across our hinterland regions, ensuring that we can take all of the services to our people. And in that way, we will be beginning that process of ensuring that we achieve our objective of universal health care.
The minister expressed her satisfaction with the outreach and noted that it is as a result of a collaborative effort to ensure that cases requiring special attention in this particular region are attended to in the shortest possible time.
1 week ago, we went across this region, myself and team, including the representative of PAHO WHO, and we were able to capture some of those persons who are in need of surgery. Today we have that team in Mabaruma from the Georgetown Public Hospital, led by the Director of Professional Services, Dr. Foster Jeffrey, along with the doctors here at Mabaruma Hospital. The persons who are going to be treated come from across the region.
According to the Public Health Minister, this is one way in which the ministry ensures all persons in Guyana access the services available through the public health sector. The outreaches also help the government to save funds which are expended on medical emergency evacuations, which mainly requires the ministry to charter a commercial aircraft. Dr. Sheko noted that these safe funds can be redirected to improving health service delivery in far-flung communities, preventing persons from traveling long distances to access these services. Speaking specifically to the surgical needs in the region, she noted that plans were put in place by the Public Health Ministry and the Regional Health Department to capture those in need of surgery.
What we did is to have a list because Region 1, like any other region, they have different sub-districts. All the hinterland regions, they have sub-districts. And Region 1 has 4 sub-districts. So we just, we ask our doctors here to enlist patients that need surgeries. Because we don't want them to travel to Georgetown or for us to be doing medvacs all the time, and it's incurring a high cost at the Ministry of Public Health.
This has been InfoHub Extended. Thanks for watching. Goodbye for now.